Person-centered care with regards to the HIV response basically means putting the recipient of care at the very center of the care.
To me, PCC is an approach of dealing with people's emotions, making sure people are receiving the right type of care, ensuring you understand the client journey and figuring out where you can intervene using person-centered approaches. What do I mean by that? Effectively, it's listening to the client, being available for them, being patient, involving them in decision-making, shared decision-making, as well as you, for instance, as a healthcare worker, providing discretionary actions that improve the services, giving them better options, giving them better opportunities. Essentially, that's how I'd summarize what person-centered care is.
And the PCC approach really takes all of those aspects into consideration to make sure that you get a whole system of care, not just tablets to drink every night.
This Person-Centred Care Advocacy Academy is extremely relevant to my work because it brings in the dimension of seeking to emphasize the place of recipients of care being at the center of care. But at the same time, it really seeks to ensure that we end up having good health outcomes for recipients of care. And basically it cuts across, not just for HIV, but also thinking of other conditions, non-communicable diseases, or need to ensure that there is person-centered care.
I think the key thing with the Advocacy Academy is actually context. I think in this sense, often when you think of the term person-centered care, it's a very Western concept. And so I think this Advocacy Academy gives us an opportunity to bring together 20 fellows from 12 different countries.
The Academy had a lot of information, but what really stood out for me is issues of communication in regards to PCC, how we really need to have communication lines with whatever the clients need and putting everything together. So from the Academy, I have learned that communication is very key in PCC, and I'm going to use this in my context to just support the female sex workers that we work with, and together we are going to improve the health outcomes here.
So there's two key things that have really stood out for me at this academy. The first is we need to stop asking patients, what is the matter with you? And start asking, what matters to you? What is the core crux of what you need in order to thrive with this condition? And the second is that there's a focus on people who are receiving the care, people who are providing the care, and most importantly, the relationship between the two. Person-centered care helps to bridge that relationship between providers and recipients of care. So taking those two lessons, I'm really going to go back and try and integrate what I've learned and the person-centered care approach into the models that we're already running in South Africa. So not by creating anything new, but by integrating and embedding into what we already have.